these are non-sterile, so you need to discard after 24 hours. So 20 milliliter normal saline ampoules that are available. So for the semi-clear lenses, you need to use 20 milliliter saline ampoule. These are easily available in Pakistan. So most of the people, these are a little bit expensive as compared to a dextrose, 500 milliliter and 1000 millimeter, but infection chances are much greater in the dextrose drip. So you always use the 20 milliliter normal saline ampoule. And for the filling purpose, do not use the RGP. You soak the lens, you clean the lens with the RGP lens solution, such as GP lens solution or Boston RGP lens solution. But if you want to fill the lens with the RGP lens solution and put in the onto the cornea, then initially, since the RGP lens solution, they are very thick, so initially the patient will feel discomfort and the vision will not be clear. So you rinse the clean with the RGP lens solution. You store the lens with the RGP lens solution. But when you are putting it on the cornea, at that time you fill the lens with the normal saline solution. Patient can handle the lens with either a suction holder or the plunger, or by balancing the lens and tripod between the thumb, index, and middle finger. If you combine the thumb, you just do it by yourself now, thumb, index finger, and middle finger. So you will combine these three fingers. This is called tripod position, and you put the lens and hold the lens with these three fingers, and you can put on the patient, or the patient can put by himself. But the plunger or the suction holder, it is very easy to use as compared to a tripod position. Small insertion bubbles are of no consequence, but large bubbles will disturb both vision and assessment of the central fit and must be avoided. This is very common when you are fitting the semi-scleral lenses, since the patient, they are usually not cooperative. So once you fit, you will see that the cell line, it comes out from the lens and you will see bubbles. So if the bubble is very small, then it will get filled with the tears and it may create no problem. But if it is bigger, then it will not be get filled with the tear and the vision will be disturbed. So you need to remove the lens, fill it again, and fit it again. If bubbles are obvious under the central part of the lens after insertion, the lens must be removed and the insertion process should be repeated. Lens removal. How will you remove the lens? Place a small solid weighted plunger between the outside of the lens and the temporopupil margin. So do not put the plunger at the center of the lens. Between the outside of the lens and the temporal margin of the pupil, that is towards the side, peel the lens off by pulling outwards across in an arc towards the nose. So outside on the inferior edge, the outside the lens and temporal pupil margin, then you will just slightly pull it outward across in an arc position towards the nose. The lens may also be removed by using the lower lid of lid to lift the lower contact lens edge up and outward. If you directly put the plunger on the lens and you pull it out, then it will destroy the cornea, the epithelial layer of the cornea. So first you need to remove, just to move towards the nasal side, and then once it starts moving, then you will remove the lens. Do not attempt to remove the lens with the suction holder placed centrally. So here this is an example. Can you see this? On the temporal side the plunger is, and then you just in a arc position bring it towards the nose side, and arc when it start movement, then you slowly remove the lens. Now lens care instructions. Gently rub the lens between the thumb and forefinger with a few drops of an appropriate multi-purpose GP cleaning and conditioning solution. So the corneal lenses, they are very small. So if you want to clean the corneal lens or to remove the debris from the lens, so the chances of getting damage is less as compared to the semi-scleral lenses, because the semi-scleral lenses, they are just like cup, they are bigger. So there are chances that due to the rubbing, the lens may get damaged. So you must be careful. Rinse the lens with multi-purpose solution. Store the lens in an appropriate lens case, flat lens case or larger size container filled with multi-purpose GP cleaning and conditioning solution. So I already mentioned you that you will rinse with the GP cleaning solution and you will put the GP lens solution in the case when you are storing the lens. But during the insertion, you should put normal saline, not the GP lens solution. Now coming to the fitting procedure. So first step in the fitting procedure is the same central fit, just like in the corneal lenses or the base curve selection. If topography is unavailable to accurately identify the condition you are fitting, so choose your first trial lens 0.2 millimeters deeper than the average cap. As I already mentioned in the yesterday presentation, we discussed about the different types of lenses, and we also saw the pictures. So if you do not have corneal topography and you just have only keratometry reading, so in this case, the first lens for the trial should be 0.2 millimeters deeper than the average cap. But these are just for normal keratoconus. If PMD, pilosomanary degeneration, or keratoglobus, then you need to go 0.6 millimeters steeper than the mean cap. And for post-graph or post-LASIK lenses, you need to go 0.7 millimeters steeper than the mean K reading. So these three are the main tips. For PMD and keratoglobus, 0.6 millimeters steeper. For post-graph and post-LASIK, 0.7 millimeters steeper. And in other cases, you just go 0.2 millimeters steeper than the average K, if you do not have corneal topography and you just have keratometry reading. So instill a saline with fluorescein into the concave side of the lens. Judge the central fit immediately after the insertion of the lens. Select flatter or steeper base curve until a very light feather touch is just discernible at the highest point on the cornea. Once feather touch is achieved, allow the lens to settle for a further 20 minutes and re-evaluate the fit. So, but remember that at first, you should put the fluorescein very laser. Otherwise, you will get a false reading and you will see the fluorescein putting is much greater. So, you need to put the fluorescein very less. One. Second, immediately after insertion of the lens, you need to see the assessment. Otherwise, after some time, the fluorescein will go away from the lens and then you will not be able to assess the fitting properly. Once you fitted the lens and you observe that yes, this is okay, then you need to wait for the 20 minutes and then re-evaluate the fit. If further fluorescein is required, place on the sclera at 12 o'clock, just above the lens, and ask the patient to blink several times. If fluorescein doesn't circulate behind the lens, manipulate the lower and or the upper edge to encourage fluorescein and to flush under the lens. So you put again the fluorescein on the sclera, and if in case of semi-scleral lens, usually the fluorescein after 20 minutes usually doesn't come directly under the lens. So you just need to a little bit push the edge upper or the lower edge of the lens, then the fluorescein will come inside the lens. Step 2, peripheral fit or edge left. Once the correct base curve has been selected, then observe the fluorescein pattern outside of the limbus at all positions around the glass. Through three 60 degree, you need to observe the fluorescent pattern. A parallel fluorescent band with a minimum width of 0.8 to 1 millimeter must be observed. In cases of cornea lenses, we usually need 0.5 to 0.7 millimeter band at the cornea, but here on the sclera, in case of semiscleral lenses, we need 0.8 to 1 millimeter band of fluorescein. Judge fluorescein immediately after lens insertion. Fluorescein will flush out from under the lens edge very quickly, so further fluorescein needs to be applied if several minutes have elapsed. As I already mentioned that you need to observe as soon as you put the fluorescein and as soon as the lens gets centered. With the optimum edge left, fluorescein should circulate under the edge of the lens. Now, if even you tried to push the edge of the lens up and down, and after that even the fluorescein is not coming inside the lens, so it shows that the edge left is tight and the fluorescein is not coming under the lens. If the fluorescein under the lens is ideal but the band of fluorescein is too wide, then consider decreasing the diameter. Now in this case, if you see the band, it is too wide. I say more than 1 millimeter. Now if the central fit is okay, the lens movement is okay, but the band is greater, you just decrease the diameter. If the fluorescein under lens is ideal but the band of fluorescein is too narrow, consider increasing the diameter. So you can increase the diameter or you can decrease the diameter if the central fit is okay on the basis of the fluorescein band. If the edge left is excessive, the lens will be uncomfortable. The fluorescein band will show dense fluorescein and may be too wide. The edge of the lens may lift up from the conjunctiva and cause subsequent bubbling under the edge of the lens. So in this case, you need to decrease the, why it is not coming? So in this case, you need to decrease the edge left. Now here, if you see, the fluorescein band is wide, right? And the edge left is greater. So in this case, you need to decrease the edge left. If the edge left is inadequate, the lens will be very comfortable on first insertion, but insufficient fluorescein or no fluorescein will be seen under the edge of the lens outside the limbus. So in this case, you need to increase the edge left. So here, if you see, you need to increase the edge left. Insufficient fluorescein is there. Fluorescein band may be irregular if peripheral astigmatism is present. Then they refer to toric or asymmetric options. We already discussed in the corneal lenses. A tight edge left may cause binding of the lens, which can cause blanching of the conjunctival vessel from the limbus to the edge of the lens, and or hyperemia to conjunctival vessel just outside the lens. So these are 2-3 steps that you should remember. If the lens edge is greater, then what will you see? The patient will feel discomfort. So it will be easy for you, as the patient is saying he's feeling discomfort, then you will change the edge left, or you will see that the edge left is greater. But if the edge left is tight, then the patient will not feel any problem, but the patient will feel problem after removal of the lens. Once you remove the lens, then the patient will feel discomfort. So it means that the edge left was tight. So sometimes if you assess a patient and the patient says, yes, I am okay, so you will say, yes, this lens is okay for this patient. These parameters are okay. But After removal of the lens, again you need to ask the patient, do you have any discomfort? If after removal of the lens the patient has discomfort, it means that the edge left was tight. Then reassess the lens fitting and observe the edge left. So fitting tips, 50% of patient can be optimally fitted with the standard edge left. 90% of patient can be optimally fitted using the normal 5 edge left, standard 0, standard increase plus 1, double increase plus 2, standard decrease minus 1, and double decrease minus 2. Judge edge left immediately after insertion and again after 20 minutes. We already discussed this. Lens discomfort on first insertion is most commonly associated with an excessive edge left. If edge left is excessive, then at the time of insertion, the patient will feel discomfort. Discomfort experienced after the lens removal indicates a tight edge. So increase the edge left in this case. With the correct edge left, with slight upward pressure on the edge of the lens at 6 o'clock by the lid, the fluorescein should be seen to enter under the edge of the lens. Having to use excessive force indicates a tight edge. Judging the correct choice of edge left is a combination of interpretation of the following 5 points. So you should remember these 5 points. The fluorescein pattern, number 1. Second is movement. Third is comfort. And how easy the lens is to remove and how easy the fluorescein enters under the lens edge with upward pressure on the lens or lower edge. So these are the points that these points will indicate about the edge left, either the edge left is optimum or not. Excessive force should not be required to remove the lens with a suction holder. If excessive force is required, it means that the edge left is tight. Changing the edge left in most cases does not affect the fit toward the cornea. So if you just need to, the other parameters, center is, movement is good, and base curve is, you selected that yes, this is the optimum, but just you only need the edge left. So in most cases, there will be no need of any change in the base curve of the lens or the diameter of the lens. You will just need to change the edge left. If the tri lens has an excessive tight edge, causing the tri lens to bear mainly on the conjunctiva, increasing the edge left may result in a flatter central fit than expected. To remedy, steepen the base curve by 0.1 to 0.2 millimeters. So in some cases, if the edge is changed excessive tight, it is excessive tight, and you judge the parameter and you need like standard 2, not standard, you need 2 or 3, then in that cases you may need change in the base curve as well. But if it is just, you can say 0.5 R1, so in most cases you will not need to change the base curve. With the correct amount of edge left, the conjunctival vessel can still be observed through the fluorescein. So this is important. If the conjunctival vessel under the lens, you cannot see this, and the conjunctival vessel outside the lens, they are inflamed, it means that the edge left is tight. So you must see normal conjunctival blood vessel inside as well as outside. If the inside are blanching or you cannot see properly and the outside are inflamed, then it means that the edge left is tight. Now, these are the 5 standard edge left. Number first, what do you think on left side? Anyone?
Sir, there is सेंट्रल में बेयरिंग है सर, पेरिफेरी में फ्लोरेसिन बैंड ज्यादा है।
हाँ, if you see between the first and the two, the second, the first one on left side and the second one, then the first one bend is much greater as compared to the second one. Can you see it?
यस सर।
So we label this, the first one is very excessive edge left and the second one is excessive edge left. So what will you do?
यस, in first one we will decrease the dia,
And second one,
decreasing the edge left.
okay, you said then in the first one will decrease the dia. But remember, it is already loose fit with respect to the edge. So if you decrease the dia, it will further get loose with respect to the edge.
Yes sir.
In the first case, you double decrease the edge left, -2.
जी sir.
The rest is the same. This is just at the center. If you see, this is just feather touch. So central fitting is good. It is optimum. But the fluorescein bed is thick and the bend is greater. Therefore, you need double decrease left, -2. Is it clear? Excessive edge left. Zanfar, yesterday you
जी
asked, how will we judge that how much should we decrease or increase the edge left?
जी sir.
Right? So
जी sir.
here in the first case, this is double decrease edge left. The second on the left side, this is the first one is excessive, very excessive edge left. The second one is excessive edge left. So the second one is standard decrease left. That is 1, -1. So the first one,
Okay sir.
-2, double decrease edge left. The second one is standard decrease edge left, that is
-1.
-1. If it is between these two, you see, oh, this picture, neither it fits into the excessive edge left, nor it fits the very excessive edge left. It is in between, then you can order -1.5 decrease edge left.
Okay sir.
Again, I'm explaining. The first one, the left one, if you see, the bend is greater, larger than the 1 millimeter, and the bend, fluorescein bend is thick as well. So in this case, it is very excessive edge left, and you need double decrease edge left, that is -2. So the edge left will be get tight. The second one is excessive edge left. In this case, you need standard decrease edge left, -1. If the pattern is between these two, then -1.5 decrease edge left. Is it okay now for these two pictures?
Yes.
No.
Yes sir.
Coming to the center one. The center bend is 10. It is good. It is about 0.9 millimeter. So this is optimal. So this is the standard edge left, 0. With the kit, you will have a standard edge left. If the fitting is like on the left side one, then you need to double decrease. If the second, it is like the second one, that's mean assessment you see with the slit lamp and you see, observe that it is like the second one, it is excessive edge left. So you standard decrease edge left. One is standard, one is standard decrease. The center one, this is the standard, that is 0. Just like
Yes.
in the assessment kit. And the second to the left is the standard decreased. So it is -1. Now coming to the fourth. So if you see the fourth, even you cannot see properly the fluorescein band. because it is very thin. Can you see it?
Yes.
Right?
Yes, sir.
So in this case, you need to increase the edge left. So here it is standard increase edge left. That is plus 1. And on the rightmost, the fifth one, here this is double. You need to double increase edge left because it is very tight. So on the top right is very tight, on the top left is very loose or excessive edge left. So on the top right, the right one, you need to double increase the edge left. Double increase mean 2. And on the left side, you need to double decrease edge left. Double decrease edge left means minus 2. Is it clear now?
Yes, sir.
यस सर. और सर दाया पर किस केस में इंक्रीज या डिक्रीज करेंगे, क्योंकि
डाई के लिए भी अभी आ रहे हैं कि how when will you increase the dia and when will you decrease the dia, right?
ओके.
This is dia, no? Step 3, diameter selection. Recommended standard diameter is 14.6 millimeter, and 60% of cases will fit with the 14.6 millimeter dia. On the average size cornea of 11.8 millimeter, the lens should extend 1.3 to 1.5 millimeter outside the lembus. For large corneas, increase the diameter to achieve 1.3 to 1.5 millimeter outside the lembus. So one step is here, how to increase or decrease the dia. You need 1.3 to 1.5 millimeter outside the lens, outside the lembus. So if it is greater than 1.5 millimeter, you need to decrease the dia. If it is smaller than 1.3 millimeter, you need to increase the dia. So this is one tip. Is it clear, Nudrat?
यस सर.
Now, for small cornea, decrease the diameter to achieve 1.3 to 1.5 millimeter outside the lembus. So, fitting tips. Decreasing the diameter may also assist with insertion and removal. As I already mentioned, that the semi-scleral lenses are larger, so insertion and removal of semi-scleral lenses are difficult as compared to the corneal lenses. So if you decrease the dia, then the insertion and removal will also get easier as compared to increasing the dia. Making the lens larger will often make the lens more stable. So on one side, that is the advantage. But the advantage of increasing dia is stability. If you increase the dia, the lens will be more stable. But you must remember that it should be between 1.3 to 1.5 millimeter on the sclera. 0.3 millimeter change in diameter can be significant. So if you need to increase the dia, you should not increase by 1 millimeter or 1.5 millimeter. So just 0.3 millimeter change in diameter can be significant. The base curve does not require any adjustment if you change the diameter. Step 4, location. The lens should sit evenly around the lembus. A decenter apex may cause the lens to locate inferiorly. So to improve the lens location, increase the diameter and or flatten the base curve. So either you need to flatten the base curve or you need to increase the diameter if you want to improve the location of the lens. Slight decentration may not cause any major issue, but may be slightly less comfortable. Now, step 5, movement. On first insertion, the lens should move about 0.5 to 1 millimeter on blinking. So you should observe the movement, and the movement should be 0.5 to 1 millimeter with the blinking. Judge movement at 6 o'clock by having the patient look up and blink. But remember, you will not be able, if the, because the semi-clear lenses, the dia is greater, and usually the the lens edge is under the lid, so you cannot see. In most cases, you will not be able to see the lens movement. So you judge the movement exercise by having the patient look up and blink. If the patient look up and blink, then you will be able to see the lens edge and you will be able to observe the movement. After lens settle, very little movement should be obvious, maximum 0.5 millimeter. So initial first insertion, it will be zero point 0.5 to 1 millimeter. You need to wait for some time, and once the lens gets settled, then the movement will decrease and it should be maximum 0.5 millimeter. It should not be less. Excessive movement makes the lens less comfortable. Since these are big lenses, larger lenses, so if the movement is excessive, then the patient will not feel comfort. Now, to decrease the edge movement, now if the movement is greater than the desired or lesser than the desired, then what will you do? To decrease the movement, decrease the edge left, right? If edge left is greater, you see that the movement is greater, then observe the edge left. If edge left is also greater, then you decrease the edge left and the lens movement will get normal. Or flatten the base curve. Now, this is, remember that the base curve is for the movement is different for the semiscleral lenses than the corneal lenses. In corneal lenses, if you flatten the base curve, the lens movement is increased. But in case of semiscleral lenses, if you flatten the base curve, the lens movement will get decreased. Why? We will discuss it now. Increase the diameter or combination of these. So if the lens movement is greater and you want to decrease it, you increase the diameter, then the lens movement will get decreased. Now, to increase the movement, will you do? Increase the edge left. Lens movement is less than the desired. You see the edge left. If the edge left is not optimum, you increase the edge left. But remember, if the edge left is already greater, then you should not increase the edge left. Otherwise, the patient will feel discomfort. So you can go for the other option. Steepen the base curve. To increase the movement, you steepen the base curve. In corneal lenses, you flatten the base curve to increase the movement. But here, you need to steepen the base curve and decrease the diameter or combination of these two. Now, why in cases of semiscleral lenses, the base curve change? If you steepen the base curve, the lens will be, movement will be increased. Because if you steepen the base curve, two things will happen there. One, greater amount of aqueous will enter the lens and the lens will get heavier, then the movement will be increased. Number two, if you steepen the base curve, then the friction force between the upper lid and the lens will get greater because the lens will move forward, so the movement will increase. And in case of flattening the base curve, the opposite will be happen there. So is it clear why this is opposite to the corneal lenses? In corneal lenses, again from the top, to decrease the movement, decrease the edge left. Okay, this is clear. Decrease the edge left, so you will decrease the movement. Flatten the base curve. If you flatten the base curve, the less amount of aqueous or saline will come inside the lens as compared to if you increase the base curve. So once you decrease the base curve, so the less saline or less tear will come inside the lens, so the weight will be lesser, and with blinking, the movement will decrease. Number two, if you flatten the base curve, the friction, the force between the outer surface of the lens and the eyelid will get smaller. so the lens movement will be decreased. But if you increase the base curve, so what will come? The lens will come out just like. So with the blinking, the movement will increase. And the second is greater aqueous will, tear will come. A greater amount of saline will come inside the lens. So the lens weight will increase, the gravitational pull will increase, and the lens movement will be increased. Is it clear?
Yes, sir.
No. Step 6 is vision. An accurate over refraction should be performed once the lens has settled after 20 minutes. So once you did assessment and you observe that the assessment is good, you need to wait for 20 minutes, and after 20 minutes you will do refraction. So fitting tips. Auto refractors can give useful starting guide for the refraction. Since the center is lens is bigger, so in semi-clear lenses you can do auto refraction. You can use auto ref, and with the auto ref reading over the lens you can do a refraction. Best corrective visual acuity at fitting is an accurate indication of the best corrective visual acuity that will be achieved. So if during the assessment the visual acuity is 6.6, so with the prescribed lens you will get 6.6 visual acuity. For follow-up visits, vision should always be checked first before any fluorescein is applied to the eye. Because the fluorescein, it may not get out in short time, so the vision will be disturbed. So first you need to take the visual acuity, then you do the assessment with the fluorescein. Going too steep centrally can reduce best vision. If the visual acuity is poor, try a flatter base curve. So if visual acuity, you checked a patient, you fitted the lens, and you did that the assessment is good, but you take visual acuity and you say, oh, visual acuity is not satisfied, it is 612 partial or 618. Is the other parameters you see that these are okay, so go for a flatter lens and again do the assessment and again check the visual acuity. So visual acuity will get better with flattening the base curve. Any question?
सही जो थर्ड वाली डायग्राम थी वो जो आपने कहा था कि हम इसको एज लेफ्ट -1 करेंगे -2 करेंगे, वो थर्ड पिक्चर जरा दोबारा एक्सप्लेन कर दें सर।
दिस वन?
यस सर, ये वाली,
ये जो मिडल वाला है,
यस सर,
ये मिडल वाला अगर आप देख ले तो ये ऑप्टिमम फिट है। एज लेफ्ट आप अगर देख ले ये तो अबाउट 0.9 मिलीमीटर राउंड अबाउट है, ठीक है। 10 है फ्लोरोसेंट। ये दो चीजें आप एक दूसरे से सेपरेट लेंगे, ये याद रखें। एक फ्लोरोसेंट जो बैंड है कि बैंड कितना है, ठीक है। एक जो अमाउंट है अंडर फ्लोरोसेंट कि वो कितना है, ठीक है। पूलिंग जो है, पूलिंग की डेप्थ जो है वो ज्यादा है या कम है, तो डेप्थ को भी आप देखेंगे और बैंड साइज को भी आप देखेंगे। बाज़ औक़ात आपको बैंड साइज जो है, दो केसेस, सपोज एक केस में जो है आपको समझ आ रही कि भाई ये जो फ्लोरोसेंट बैंड की साइज है ये अराउंड अबाउट 1.2 1.3 मिलीमीटर है, ये दूसरे में भी 1.2 या 1.3 मिलीमीटर है। लेकिन एक में जो फ्लोरोसेंट की डेप्थ है वो ज्यादा है और दूसरे में फ्लोरोसेंट की जो डेप्थ है वो 10 है। तो जिसमें वो फ्लोरोसेंट की डेप्थ 10 है उसमें आपको एज लेफ्ट को कम डिक्रीज करना पड़ेगा एज कंपेयर टू दैट जिसमें फ्लोरोसेंट की जो डेप्थ है वो ज्यादा थिक है। ये फर्स्ट टू में अगर ये आप देखें तो आपको अंदाजा हो जाएगा कि ये फर्स्ट वन में बैंड थोड़ा सा ज्यादा है सेकंड वन से, लेकिन फर्स्ट वन की जो डेप्थ है वो डार्क है, वो ज्यादा है एज कंपेयर टू द सेकंड वन. सो इसलिए फर्स्ट वन जो है वो एक्सेसिव एज है और वेरी एक्सेसिव एज लेफ्ट है, और द अदर सेकंड वन जो है ये ओनली एक्सेसिव एज लेफ्ट है. तो फर्स्ट वन में जो है डबल डिक्रीज करना चाहिए और सेकंड वन में जो है सिंगल डिक्रीज करना चाहिए. जो मिडिल है, मिडिल में अगर ये आप देखें तो बिल्कुल जो बेंड है, बेंड भी तकरीबन 0.9 मिलीमीटर है, और जो थिकनेस है फ्लोरोसेंस की वो भी अगर आप देखें तो बाज जगह पे बिल्कुल आपको वो नजर आ रहे हैं कि ये जैसे एपिकल बियरिंग तो नहीं कह सकते हैं, लेकिन बिल्कुल अलाइनमेंट फिट आपको नजर आ रही है. सो दिस इज द ऑप्टिमम, द सेंटर वन.
ठीक है सर, थैंक यू.
अच्छा, ये जो लास्ट वन है इसमें थोड़ी से आप लोग कंफ्यूज होंगे कि ये सेंट्रल फिट जो है ये 100% आप नहीं कह सकते कि सेंट्रल फिट जो है ये सही है. समझ आ रही मेरी बात? जो लास्ट वन है आप कहेंगे कि सेंट्रल फिट तो बहुत स्टीप लग रहा है इसमें, इसलिए स्टीप लग रहा है कि फ्लोरोसेंस ज्यादा है कि उधर जो पेरिफेरी इतनी टाइट है कि आपने ऊपर से पुश किया फ्लोरोसेंस तो सारा अंदर आ गया, लेकिन अब निकल नहीं रहा है.